So this will be the first block for the third exam. Had to figure out where we were. We start with that. We just did reproductive systems. So in conjunction with reproductive systems, we are going to talk about sexually transmitted diseases. STDs. Now, a sexually transmitted disease is called that because that is a main way of getting it from a person to another person. It may not be the only way to get it. There are sexually transmitted diseases you actually can pick up off of toilet seats. I know that a lot of people consider that to be a myth. And for a lot of sexually transmitted diseases, it is a myth. But there are some bacteria that will persist on surfaces for a while. So it is potentially a risk. It's a fairly minor risk. And of course, HIV, which is a sexually transmitted virus, AIDS, a sexually transmitted disease, can also be passed from mother to baby during delivery. It can be passed in blood transfusions, but it's primarily a sexually transmitted disease. You're going to get differences in how this plays out, these different diseases play out in the male system versus the female system, which is why we're following up the two systems with this. Is that the male system is it isn't as good a support surface for a lot of organisms. And in order to be sexually transmitted, the organisms have to be able to live in the male system so that he can transmit them to the female. But for a lot of them, especially the ones that wind up in the urethra, they're just kind of hanging on in there. Is that they don't really set up shop, and so a lot of times they don't cause symptoms. And when they do cause symptoms, they're more noticeable in men because you wind up with pain on urination, things like that. A lot of these diseases are diseases of surfaces, and a lot of them are diseases of kind of external surfaces. In the males, those surfaces really are external, and so they're noticeable when you get rashes or marks or sores. You can actually see them and feel them. In females, the surfaces are vaginal surfaces a lot of times, and the pain may be more diffuse, it may not be as specific, and it's certainly not visible. So men are much more likely to have noticeable symptoms, and things like chlamydia and other things that don't really affect urethras can hang out in urethras and be transmitted to females and not really show any symptoms in men. But for the most part, men's symptoms are going to show up more. Maybe that's balanced out by the tendency of men to kind of ignore them and not go have them checked. I don't know in terms of health balance, but this definitely plays out differently. A lot of these play out differently in men and women. In women, too, so the vagina attaches to the uterus. The uterus attaches to the oviducts. The oviducts are open to the abdominal cavity. Remember, they're not sealed up against the ovaries, they're open. Something coming up the oviducts can actually get out the end. And for some diseases like gonorrhea, it's very unusual for them to work that far up the system, but it is possible for them to get into the abdominal cavity, get into the general circulation, and cause some pretty nasty side effects down the road. It's unusual. It's not that easy for them to get there. There are a number of bacteria. I mean, there's a huge number of bacteria that live in the female system, because the female system has its own microbiome, and most of those bacteria are perfectly benign. They don't seem to be doing anything bad. In fact, if anything, they may be helping as a defense against invasive bacteria and possibly viruses. Chlamydia is probably would have been classified as one of those bacteria, except it has potential to get up into the oviducts and affect the linings. Now keep in mind the oviducts are producing a current with cilia that moves the egg cell down to, or the embryo down to the uterus. If something compromises that lining, the current is compromised and you wind up with complications where you wind up with ectopic pregnancies in the tube. The embryo hits that sticky point. It's not where it's supposed to be. It sticks to the lining of the oviducts. And in some cases, the chlamydia's presence causes inflammation in the tubes. In some cases, the inflammation can actually close the tubes up. And actually, chlamydia was discovered not really for its disease potential, but more for its infertility potential. As I remember many, many years ago, talking to a friend of mine who worked in the state health department. It's like, what are you working on? And it's like, oh, this new bacterium that we're looking at, and it was chlamydia. And chlamydia was not new. It's just nobody had had any reason to notice it until fertility became a medical area. And then people started to look into why are some people infertile. And then they discovered, oh, sometimes there's damage inside these tubes. And now we got to figure out what's causing the damage. And then they discovered chlamydia. Is that some of the other stuff we're going to talk about have been known a lot longer and also can cause damage in the tubes. But it can also cause a lot of other things that were way more noticeable, including those kind of nasty complications. And there are a few other bacteria that can behave similar to chlamydia. Chlamydia is very common, and in a tremendous number of people, men and women, it is not noticeable. In men, it's very, very, very rarely it produces any kind of noticeable symptoms. We're going to stick with bacteria. Gonorrhea is another bacterium. It's another surface bacterium. It invades linings, but it can cause a decent amount of damage to internal linings. It can scar the oviducts and have effects on fertility. It can potentially get into the general part of the body through the abdominal cavity. It can cause pelvic inflammatory disease. And if bacteria being shed from the linings, it also lives in the linings of the vagina and the uterus. If it's in there and you deliver a baby past it, and the baby picks up gonorrhea bacteria on its eyes, it is possible to get complications that causes blindness in infants from gonorrhea. For a long time, one of the first things they would do with a new baby is they would put drops in its eyes, just on the off chance, because you don't necessarily always know that it's there, and they don't always run tests to see if it's there. And they would put drops in the eyes that would kill any potential bacteria. And the drops were, didn't have side effects, so why not put them in the drop? The drops were silver nitrate. Back in the 70s and 80s, the price of silver went through the roof. Silver nitrate became very expensive. The gonorrhea was getting much rarer. It was very treatable, mostly. I'll come back to that. So they went, we don't really need to do that. And for a while they weren't doing it, and they discovered, we kind of, there were enough cases of babies having vision issues with the gonorrhea contamination that they went back to it. And they tried other antibiotics. I think now they've gone back to silver nitrate. That's what someone told me. This is, in terms of basic practice, I do a lot of reading, but basic practice stuff doesn't always wind up in the reading that I read, so sometimes I have to ask people that are working in the field. So some stuff that's, back and forth, I know where we are, and some stuff I don't because I don't have the connections. So Just as some of your sources are wrong about things, I'll tell you right now, I'm wrong about some things because I can't be up to date on everything. And a lot of medical stuff vacillates where we're doing it this now, and now, okay, we're doing it another way. And we'll talk about that in other contexts as we go along. Gonorrhea also is one of those bacteria that is fairly good at evolving antibiotic resistance. So there are a number of strains of gonorrhea that penicillin won't bother, or penicillin and tetracycline won't bother, or all the various variacillins won't bother. For a while during the Vietnam War, a strain developed that they were calling super gonorrhea, where they were down to like one antibiotic left on the list that it wasn't resistant to, and they were kind of fearing that if it developed resistance to that they didn't know what they were going to do about it. But then the war ended, and it turns out these resistant strains, kind of in the wild, where they're not having a lot of antibiotics thrown at them, they have changed their chemistry so the antibiotics won't hurt them. But a lot of times that change in chemistry makes them not as efficient without the antibiotics as their non-resistant relatives. And they're kind of eventually driven out of business, is that their other relatives much more efficient at reproducing and spreading. So the resistant strains kind of gradually disappeared. It's, natural selection in nature as opposed to the unnatural selection of us throwing antibiotics at it. Syphilis. Possibly the only disease that during the age of exploration may have come back with the explorers. Again, there's a lot of debate, is that when you're trying to find out if syphilis existed before that period in Europe, it's not that easy to pin that down. I mean, what do you check? Is that some people think that they found syphilitic lesions on older bodies, older corpses from in Europe. Some people think they found genetic indications that syphilis was around before that, but nobody knows for sure. It definitely existed in the New World. It could be really, really old and just existed everywhere as people spread. They took it. It's a very slow-acting disease, and so it can be spread really easily, and it doesn't interfere with its host for a really long time. In fact, it goes through 4 phases. That's 4. So the bacteria can come in through a surface. The condoms are good at preventing a lot of these things from transferring from surface to surface. Gonorrhea too. So the bacteria come in through a surface and spread a little bit and form a little sore, just a little sore. And it's internal very often in women, so they're not necessarily aware that it's there. In men, it's external, and they're aware it's there. And it's like, gee, I wonder if I should get that looked at by somebody. Maybe there's something bad going on. The issue with syphilis is even in this era where we can cure it, we can kill it with antibiotics. If you hem and haw and you take a while to actually go see your doctor, give it like a week and the sore goes away. And you go, oh, well, I guess it was nothing. But the bacteria are then spreading. But they're not obviously spreading until your immune system kind of starts to mount a response to them. Your immune system's really terrible at dealing with syphilis. It can exist in you for a really long time, and it's one of those things where your immune system can't really get a hold of it and knock it completely out. But a few weeks, varies a lot from person to person, after that first sore has gone away, you will develop a rash centered on the sore point, but the extent could be really different. It could go out a little ways. It could be from like your knees to your chest, depending on the person. And it's like little red spots. They're noticeable in most people. They're not particularly itchy or anything. It's just kind of a weird rash. And again, you go, oh, wow. And if it's really not obviously centered on that point, you may not even know that there's a connection, because weeks have passed. And you're going, maybe I should go see somebody about that. It will also go away if you wait it out. Then the problems begin. The syphilis then spreads more system-wide, and it can take a long time. It can take months to years to cause damage, but it can cause damage all over the place. And typically when you get a disease that causes damage all over the place, you have parts of yourself that are much more, when you get them damaged, you're gonna know a lot faster. And in syphilis, people tend to notice the nervous system effects, because it gets into your brain and it messes with your brain. And it can drive you crazy. But it also can affect your heart. It can affect a whole bunch of other things. And at this point, it's causing honest to goodness damage, which in a lot of places is irreversible. There's some parts of your body that you can kind of fix when it's been damaged, but there's a lot of parts like your brain and your heart muscle where we can kill the bacteria, we can stop the damage, but we can't necessarily reverse it because your body's not good at repairing that stuff. Hopefully, it doesn't get to that point, but it does in some people. Was a major problem in Victorian England, and people were aware of it. And they kind of were aware of how it passed, but hard to get people to give up sex. This is not a bacterium, this is a virus. And I do expect you to know the differences between those two. I just got done correcting research papers, and I had two different people who were doing the history of a bacterium, and halfway through the paper, they decided it was a virus. Bad. It's like not knowing the difference between an elephant and a 747. There are major, major differences. Herpes, a virus related to a bunch of other similar, the herpes is a whole group. Chickenpox is a herpes virus. Genital herpes, also called genital warts, is a herpes simplex. There's herpes simplex 1 that tends to cause sores around the mouth. This is herpes simplex 2, although herpes simplex 1 can be genital and herpes simplex 2 can cause sores around the mouth. It's very closely related. Herpes viruses come in through the surface and they invade nerve cells, which is a good place to get into, because once you're in the cell, you're kind of isolated from the body's immune system, so you can kind of hang out there. And nerve cells, my nerve cells were formed when I was a fetus, and they've been the same nerve cells ever since. So they're gonna live as long as I do, for the most part. So they get in there, and they occasionally will have a little burst of reproduction and send a bunch of viruses out, and your immune system actually reacts to it and causes an inflammation that cracks your skin. And that's the easiest way for the viruses to get out and get onto the skin of another person, contact to contact. They used to think that you could only shed viruses if you actually had a lesion, actually had a broken skin area. But they've since found in some people they shed viruses with no visible marks. But the thing is, the producers of the virus, these are their offspring. The producers of the virus are still in those nerve cells, and that's where they stay. The same thing happens with chickenpox, where it gets into nerve cells along your spinal cord, and many, many, many years later, we'll start to shed viruses along the whole trunk of nerves from that pocket and cause shingles, where you get this long streak of inflammation as you're shedding essentially chickenpox viruses. But genital herpes is related, but a different herpes. Virus, we do have treatments. The treatments affect the virus's ability to get out of the nerve cells. So if you have an outbreak and you take the treatment pretty quickly, it can really lessen the effects, because the viruses are not getting out. And if the lesions are caused by your immune response to the virus is not getting out. You're not shedding them to other people as much. Doesn't get rid of them. The ones that are in your nerve cells are still in your nerve cells, but it's better than nothing, right? You can't get at these with a chemical, and they're not really doing anything except the chemistry that gets them out of the cells. They're not doing anything you could poison without screwing up the cells they're living in. It's like, it's like there's a rat infestation in this neighborhood, and somebody goes, well, we can go in and burn all the houses down, that'll get rid of them. Yeah, not really the best response. That's the problem with viruses, is most of the things you're gonna do to kill them is gonna kill the host that they're living in. HIV/AIDS, I talked about earlier because although I actually talked more about coronavirus when we were talking about viruses, this is a relatively new disease. It dates back to the 1950s and 60s. Probably jumped over from a monkey SIV virus, simian immunodeficiency virus, and it affects cells in your immune system. You've got whole bunches of different types of white blood cells. Your white blood cells are your immune system. We'll talk about that pretty soon when we get to the immune system. Imagine an army, if you know anything about the military. And there's all sorts of levels of battling and supervision and organization in an army. HIV infects your T4 cells. These in an army would be the sergeants. The sergeants get the orders from above, kind of make sure the soldiers get deployed and do what they're supposed to do. HIV gets into those cells, and in the process of making more viruses, will kill them. Now, our immune system is actually pretty good at rounding these things up as they come out of the destroyed T4 cells. But it'll get ahead of you in most people. We talked about this earlier with escape mutants, where you do develop antibodies to them. The antibodies keep them under fairly good control. We do have treatments for them. This is a weird virus, is it does a couple of chemical things that your cells never do, and so the treatments go after that to shut that down. And so it's a treatable virus, but it's not a curable virus. Is that you can go after the chemistry that helps them make more viruses, but you can't really take out the viruses that are already in there. But if you can keep them from spreading, that's pretty good. And your immune system does that until you get a mutant where the little molecule your antibodies recognize isn't shaped the same way and they can't fit on there. And then it spreads into more T4 cells. Your T4 cells have been somewhat depleted already, and it just wipes out the rest of your sergeants. And then you got no immune response. Is that you've got cells to do the battling, they don't know what to battle. You've got the cells up top kind of recognizing what needs to be done, they can't get the orders down to the battlers. And so acquired immune deficiency syndrome, other stuff that you would ordinarily have antibodies to and just fight off pretty easily, comes along and kills you. Is that there's bacteria that live in everybody's lungs that only in very rare cases can produce a deadly pneumonia. Well, that's because our immune system keeps it from doing that. Take the immune system out, pneumocystis pneumonia. That's how they discovered AIDS in the first place. Okay, the next one's a little bit less worrisome. There's 3 different species of life that infest humans, right? And lice are infestation, not an infection. And these are pubic lice, sometimes called crab lice. Is that you have head lice, which have these kind of claws that allow them to hang onto your skin around the bases of your hairs, because your hairs are fairly big compared to the lice. You have body lice, which are really good at hanging on under clothes. And pubic lice live where you would expect. The hair coming out of your skin is much thinner. And pubic lice have these big grabbers that they hang on to the base of the hairs. So under a dissecting scope, they look a little bit like crabs, so they call them crab lice. And they lay eggs, and the eggs can pass directly from people to people and hatch into new little bitty lice. Lice are a type of insect. And also the eggs can drop onto beds and can be passed to people. So that is one of the things you you can pick up from, not directly from another person, but very indirectly from a person. Say, you know, used a bed, or, you know, they're not that good at coming in through clothes. So you would kind of have to have contact, skin contact with hatched eggs. But it's primarily a sexually transmitted disease. And if I weren't running really late, I would tell you my story about my own encounter with pubic lice, but I'm sorry. I can't really, this has already gone too long.